Well, hello everybody, Mike Prevost from MikePrevost.com here. This is part two of our series on type 2 diabetes, and in this part of our series we start talking about what you can do to intervene. Well, if you haven't watched part one of this series, I really recommend that you go in and give it a look because you'll have a much better understanding of our central idea here and the importance of our central idea. And that's detecting this process early and intervening when it's still reversible. And we discussed this slide in part one, but to reiterate, how do you know when you're on this path from insulin resistance to type 2 diabetes? How can you determine that you're on that path long before blood glucose levels are elevated? And here was three ways to know, or three indicators that you might be on that path to insulin resistance and type 2 diabetes. The most definitive was, of course, elevated insulin, but it's not normally a lab test that's performed routinely. But a lab test that is performed routinely is blood lipids, and we discussed why and even discussed the mechanisms why triglyceride to HDL ratio would be elevated in insulin resistance. And if you have a triglyceride to HDL ratio greater than 3, you might suspect that you're developing insulin resistance, which could lead to type 2 diabetes. And again, ideal ratio there, though, is less than 2. The other thing is visceral obesity or abdominal obesity, especially fat around the internal organs. So if you have lots of belly fat, it's probably safe to assume that you're on the process of developing insulin resistance and that it's time to intervene now. Well, in terms of early treatment, here's the things we're going to focus on: weight loss, appropriate carbs, exercise, and sleep. All four of these can have a profound impact on insulin resistance. So why are those early markers so important? Well, those early markers are so important because when we look at the progression of type 2 diabetes, from insulin resistance to late diabetes, we know that remission is possible. Remission is basically reversal of the symptoms back to normal. And remission is more possible the earlier we catch it. And so what we know from the research literature is that you can get complete remission, especially if you catch it really early before blood glucose levels start to rise. Once blood glucose levels start to rise, but they haven't hit diabetic levels yet, you can still get a significant amount of remission. But once you get to late diabetes, normally what we see is only partial remission. We don't see as significant a remission as if you catch it earlier. Now, it's possible to get complete remission in late diabetes. It's just much more unlikely and much more difficult. If we catch it early, it's a lot simpler and a lot more likely to get complete remission of type 2 diabetes. So this is an important point. Diabetes, this process of developing type 2 diabetes is not like a disease that you catch and the only treatment is medications. This is something that's preventable and reversible, especially if we catch it early. Well, this is probably the most important consideration here. There's a ton of research out there now showing that remission is driven primarily by weight loss. I mean, it's the number one thing you can do to drive remission of type 2 diabetes and insulin resistance is to lose weight. And a 5 to 10% weight loss improves insulin sensitivity, and it does that whether you're obese or just slightly overweight. 5 to 10% is about the right number regardless of your weight status. And furthermore, if you can reduce your body weight by 5 to 10% and keep that 5 to 10% off, then insulin sensitivity remains long term. So it's a really important consideration. Weight loss and maintaining the weight loss are absolutely the key. Well, what about carbohydrate intake? Since insulin resistance is primarily a carbohydrate intolerance disease, there's a lot of discussion on the internet about reducing carb intake. Well, I can tell you there's not a lot of controversy about this anymore. Short-term diet studies tend to show more favorable outcomes with carbohydrate restriction or with a lower carbohydrate diet. And But you know, some long-term studies have shown pretty much equal results with low carb and high carb. But I want to point out something that, you know, in the long term in these studies, dietary compliance is not that great. You know, so when we are looking at 1 year and 2 year follow-up, what we expect is most participants to kind of regress to the mean. What does that mean? That means most of our participants that were on really low fat diets, we expect probably to drift more towards moderate fat over time. And most of those subjects that were on really, really low carb diets, we expect to drift towards slightly higher carbohydrate intake over time, since everybody's regressing to the mean. And so what does that mean? That means that the high fat groups become much more like the low fat groups, and the low fat groups become much more like the high fat groups, because everybody sort of regresses to the mean. And that may explain why long-term studies show very little difference, whereas short-term studies tend to favor low carbohydrate. Almost all of these studies use self-reported dietary intake to assess what people ate. And there's a lot of problems with self-reported dietary intake. Number one, people lie, and they lie in a way that tends to please the experimenters. In other words, if the experimenters are expecting them to be low carb, they will maybe over-report their compliance with low carb, you know, that kind of thing. So, you know, we have reasons to believe that low carb probably is more effective short-term and long-term. Now, that doesn't necessarily mean ketogenic levels of low carb are really, really low carb, but it tends to be a little bit more favorable. And we do know that metabolic markers are generally better with low carb, but not always. And I'm a perfect example of that. Low carb really, really spikes my cholesterol and LDL cholesterol levels. So there's lots of individual variation, and you're an individual, not a group. And so if you start messing around with macronutrient ratios, I highly recommend testing blood lipids to see how you respond. You know, the bottom line is you got to find what works for you for weight loss. And because weight loss is much more important than macronutrient composition in terms of remission of type 2 diabetes. That's a very, very important point. So it's not just about low carb. What the studies have shown is low carb or high carb, or everything in between, works equally well for remission of type 2 diabetes if the weight loss is equivalent. In other words, it's all about the weight loss. And so whatever drives weight loss for you, that's what you need to do. Well, here's a bit of good news concerning exercise. Not only can exercise help with weight loss, but it can directly help with glucose clearance or normalizing blood glucose levels. So let's review a little bit before we start talking about exercise. Remember, in the last part of our series in part 1, we talked about insulin interacting with the insulin receptor. So insulin binds to the insulin receptor, and then it causes a signaling cascade. A whole lot of signals happen inside of the cell. And, you know, part of that signaling cascade activates a protein complex called ASI60, which becomes phosphorylated. And when that happens, it causes the release of a transporter called GLUT4. And what happens is that GLUT4 goes to the surface of the cell, and it starts bringing in glucose. It starts taking glucose up into the cell, basically starts clearing glucose from the blood. So in that way, insulin binding to the insulin receptor is directly tied to clearing blood glucose from the blood through that GLUT4 receptor. And that's a normal process. Now, in insulin resistance, of course, we know that there's a blockage, basically, and a blockage primarily here at the IRS. So in insulin resistance, the IRS functionality is not working as well. It's inhibited, and so that whole signaling cascade gets inhibited. Now, the good news is exercise can directly act on this ASI60, even though the IRS signal is inhibited. And exercise can also cause these GLUT4 receptors to appear on the surface of the cell and to clear glucose. So that's an important consideration. Even a small amount of exercise does this. And this is happening in the skeletal muscles where 75 to 80% of blood glucose is cleared. Well, here's an example of some data from the Journal of Diabetes Care. And they were comparing a diet group to a diet and exercise group and looking at glucose clearance, basically clearance of glucose from the bloodstream. And so the vertical axis is glucose clearance rate, and then you see here the diet group and the diet and exercise group, both of those. Well, what they found, of course, is that there was improved glucose clearance with the diet group. So you can see that, after starting the diet, their glucose clearance was better. But clearly, when you add exercise, you get much, much better clearance, much better glucose clearance. And so you can see that the exercise group compared to the before group, glucose clearance is more than doubled. So that's pretty good. That's a pretty big impact. Now, in the case of this study, subjects were walking 19,000 steps a day. That's a significant amount of walking, but it really, really had a large impact. So you might say 19,000 steps a day is just not sustainable with your lifestyle because you just don't have time to walk 19,000 steps a day. Well, the good news is there's been a number of studies. This is just a couple of examples using much lower exercise volume and showing that even much lower exercise volume can really help. So the data on the graphs here is from a 10-minute walk after each meal. And if we look at graph A, this is glucose levels. And so higher glucose levels is worse, right? Because that's hyperglycemia that we see in insulin resistance and diabetes. And what you can see here is the group with the dark circles is a group that did a 10-minute walk after each meal, and compared to the control group. And you can see a significantly lower blood glucose level during the course of the day from just a 10-minute walk after each meal. And also the good news, remember in part 1 we said part of the pathology was due to increased glucose, but part of the pathology was due to increased insulin. You see here insulin levels. You can see that the 10 minutes of walking after each meal also significantly reduced insulin levels, which is also really good news. So just a little bit of extra activity, in this case 10-minute walk after each meal, can make a significant difference. Other studies have shown that small bouts as little as 3 minutes of activity, in this case walking or other activities like I think they were doing standing, marching in place, and leg lifts and partial body weight squats. But basically 3 minutes of activity, either a walk or some of those calisthenic exercises every 30 minutes during the day had a significant impact. So it doesn't have to be 19,000 steps a day. It can be just a little bit of extra activity during the day. Well, the other thing that works is high intensity interval training. And so if you don't have time to accumulate lots of exercise, you can get a pretty good impact from very short sessions. So basically, this is some data from one study that looked at the impact of 6 exercise sessions total. Basically, they showed up and exercised 6 times. That was it, just 6 exercise sessions. Is that enough to impact glucose tolerance? And it is. And what the exercise sessions consisted of is 10 rounds of 1 minute hard, 1 minute easy. So it's really a total of 10 minutes of exercise with 10 minutes of recovery. So it's a short session. And, pretty much like we showed in the last class, if we looked at blood glucose, it was significantly lower with only 6 exercise sessions. That's it. And, 24-hour glucose concentration, the same thing. It was much lower afterwards. And that's only 6 sessions. That's a pretty impressive impact. So we gave you some options in terms of exercise. Long walks work great, but also short periods of activity interspersed throughout the day also are a really good option, and also high intensity interval training if you don't have much time to train. Now I want to look at a dietary factor, and specifically carbohydrates. And what you see here is a graph from a really interesting study published in 2015 that really upended what we thought we knew about glycemic index. And this was published in the journal Cell. And what they did was they tested hundreds of individuals to look at their response to different types of carbohydrates. And they tested some other things too, but for our purposes, that's what we're going to discuss. And what I want you to look at is the individual response of two subjects to bananas or cookies. And this is consuming a 50-gram carbohydrate load from either bananas or cookies. So the bananas are in yellow. And you notice participant number 445 had a pretty big spike in blood glucose from bananas, but cookies had almost no impact on his blood glucose at all. Very little impact. Well, the exact opposite happened in participant 644, who had a spike in blood glucose from cookies, but bananas had almost no impact. You see the tremendous difference in those two subjects, and that's pretty much what they found across the board, was lots and lots of individual variation. And in some follow-on work where they tailored the individual's diet to the carbohydrates that they responded best to, meaning the carbohydrates that had the lowest impact on their blood glucose, they found much more favorable results. And so Rob Wolf in his book, Wired to Eat, has an interesting proposal, and that's a simple 7-day carbohydrate test. And for 7 days, you test a number of carbohydrates to see how you react individually, because we know that everybody's different and that your response is going to be significantly different. And in Rob's test, he recommends consuming 50 grams worth of carbohydrates of that food. 2 hours later, you test your blood glucose using a simple blood glucose meter you can get at any drugstore for about $15 to $20. The test strips are really, really cheap. It's just a finger prick test. And the idea is that the target is a value of less than 115 milligrams per deciliter. And so if you get at that 2-hour test a value of less than 115 milligrams per deciliter for a 50-gram load, then that's a safe carbohydrate for you. So I want to expand on that just a little bit because I think it's a really interesting idea. So we want to eat a 50-gram carb load of that product. So what does that mean? Well, let's walk through an example using this nutrition label here, which happens to be off of a container of oatmeal. So we see that the serving size is a 1/4 cup, uncooked, okay? And if we measure out a 1/4 cup uncooked, we see that it's got 15 grams of carbohydrates. But in the US, carbohydrates also include fiber, which is non-digestible. So basically, to get the true carbohydrate, or the net carbohydrates, we need to subtract the fiber. And so what we get is 12 grams of carbohydrates per serving. So if we multiply that by 4, we get 48 grams, right? And so for this product, just a little over 1 cup gives us 50 net grams of carbohydrates. So we would measure out a little bit more than a cup, and then that's what we would use for our carb test. We want to test first thing in the morning before we've had anything else to eat. It's okay to have black coffee but nothing else in the coffee when you do this test, but you want to test each food exactly the same way. So if you have black coffee on Monday, then you want to have black coffee on Tuesday and Wednesday, etc. When you consume the 50 grams of carbs, you want no exercise until you test. So you want to basically plan on not really doing anything strenuous for the next 2 hours and not eating anything else for the next 2 hours. And then at the 2-hour point, you test your blood glucose, and then you have a value. And again, what we're trying to target is less than 115 milligrams per deciliter. If you want to read more about that, pick up Rob's book, Wired to Eat. Well, this is an example from my own personal data. Here's some of the foods that I tested. It's just some of the carbohydrates that I tended to be eating at the time, and I probably need to test some more. But you can see from the values that the only thing that really was flagged for me was white potatoes. They really spiked my blood glucose, and 2 hours later they were not back down to normal. But everything else I tested was okay and turned out to be just fine, especially oats, any type of oats. You can see oat bran and muesli, which is basically a rolled oat cereal type product. are especially good. And so that's where I focus my carbohydrate intake, is on those particular safe carbs. Well, sleep can have a significant impact on this process as well. And there's a number of studies now showing that even one night of interrupted sleep can have a measurable impact on insulin resistance, and even people that don't have insulin resistance. So there's some kind of a physiological link between inadequate sleep and insulin resistance. And we know that insulin resistance and type 2 diabetes are much higher in shift workers, people that work at night and try to sleep during the day, because we know they have lots of disrupted sleep. Sleep is vitally important. It'll be really hard to make progress towards remission of these symptoms without getting adequate sleep. I mean, it affects everything from motivation and resolve. People that tend to be sleep deprived tend to snack a lot more, maybe because there's more craving for sweets or some type of an interference with our hunger and satiety mechanisms when we lack sleep. And of course, then there's low energy, which makes it much harder to participate in any type of physical activity. It's really hard to overemphasize this. If you really want to have some success at remission of this process, one of the things you really got to focus on is sleep, adequate sleep. Well, there you have it. I mean, the early treatment is actually pretty simple. You know, it's a simple concept, but it may be difficult in practice. But you got to figure out a way to get it done, because remission through lifestyle modifications don't have side effects, and you can actually completely reverse this disease process if you catch it early and you use these lifestyle modifications. You know, the most important is going to be weight loss, and whatever it takes, whatever diet works for you to achieve weight loss is what you need to do. There tends to be slightly more favorable results in the research literature from low carb. I recommend Rob's 7-day carb test. I think it's an innovative idea. It's really simple and inexpensive and can give you an idea how you react to specific carbohydrates and help you to tailor your diet to avoid those carbohydrates that really spike your blood glucose levels. We talked about how exercise works. Doesn't have to be a lot. Even a 10-minute walk after each meal can have a significant impact, and why a focus on sleep is so important. Well, there you have it, folks. I hope you learned a little bit, and I hope you're motivated to take some action. This is a super important issue, as somewhere around 1/3 of adults are going to be diagnosed with type 2 diabetes, and many more than that are going to be somewhere on the path but will not have been diagnosed yet because their blood glucose is not quite elevated enough, and most of those will be dealing with the effects of insulin resistance on heart disease and atherosclerosis. So it's super important to deal with this issue. As always, if you have questions, head on over to MikePrevost.com and submit a comment, or hit the contact me button and send a question over, and I'll do my best to answer it. If you enjoyed the presentation and felt like you learned something, please spread the word. And as always, thanks for listening.